Good evening. My name is Ron Miller, and I am a physiatrist or specialist in physical medicine and rehabilitation at OrthoIndy. I'm just going to talk a little bit here and give you some updates on who I am and what I do while we're waiting for a few more people to get online here. This is a very informal presentation, and I hope everybody enjoys it. I originally did my training. I went to undergraduate at Southern Methodist University in Dallas, Texas, did my medical school training at the University of Texas, and then did my residency training in physical medicine and rehabilitation at Northwestern in Chicago, at the Rehabilitation Institute of Chicago. And I've now been down here at OrthoIndy for 23 years. So really enjoyed the city of Indianapolis. I'm originally from Southern California, so it's been a little bit of a change moving to the Midwest, but it's been a great place. We've raised both our children here, and really enjoyed being here at OrthoIndy. So as we're waiting for more people to come online here, tell you a little bit more about my specialty, which is physical medicine and rehabilitation. I am a physiatrist. Most people may not have heard of a physiatrist or have had any encounters with physiatry, unless you yourself was injured or needed to see a physiatrist or maybe a family member. Our focus as physiatrists is not only on relieving pain, but also on restoring function for patients and getting you back to the physical lifestyle and function that you've become accustomed to in your life. Today, we're going to be discussing lower back pain or pain in the lumbar spine region. Certainly all structures in the spine can cause pain, but today we're going to be focusing primarily on the lower back. Lower back pain is an extremely common condition. It's probably one of the most common conditions for a person to seek the help of a physician, right up there with the common cold or upper respiratory infections. Nearly everybody in their life is going to have some episode of lower back pain. Lower back pain is most commonly caused by physical activities, so manual laborers will typically have a lot of lower back pain, but it can be caused by something as common as bending over to tie your shoes or picking something up off the ground. That can be enough to set off an episode of lower back pain. So what causes back pain, and how can it be treated at home, and what can we do to prevent it from occurring and continuing to occur? That's going to be the focus of today's talk. Prior to talking about the causes of lower back pain, it's important to discuss and know the anatomy of the lower back and those structures that can be injured and cause back pain and inflammation or injury. So I brought a little model here. This is a model of the lumbar spine. The lumbar spine is composed of 5 lumbar vertebrae, beginning from the top, so L1, L2, L3, L4, and L5. And those vertebrae sit directly on top of the sacrum, which is the lower part of the spine down here. In addition to the vertebrae that we talked about in the spine, the 5 vertebrae, there are also nerves that exit at each level. These are the little yellow structures here. There are also the facet joints, or these little joints where the vertebrae articulate with each other. Those are joints just as we have in any other part of the body, which allow the bones to articulate with each other, no different than the knee or the shoulder, the hip. There are the sacroiliac joints where the sacrum connects to the pelvis, and that's the connection between your lower back and your lower extremities, essentially through your pelvis. And then the discs themselves, we'll talk about how they can become injured and cause pain. Bone, of course, can cause pain through fractures. That's the most common reason to have pain originating from the bone. These compression, or these vertebral bodies can become compressed through trauma where they collapse on top of each other, or in an osteoporotic person, an elderly patient that may have a lot of thinning of the bone. They're more susceptible to these fractures where the vertebrae can collapse on each other. This will cause significant back pain. In the back of the spine, these little structures here called the pars interarticularis, or it's a little area of the bone between the facet joints. Those can become injured, especially in young patients, teenagers who are skeletally immature, and may have an injury, very common in cheerleaders, gymnasts, anyone who does a lot of extension of the spine, puts a lot of stress through there, and they can get a stress fracture through that bone. The discs themselves can cause pain. The discs typically don't have a lot of nerve supply. However, the outer portion of the nerve, or of the disc, called the annulus, does have some nerve fibers. These discs through life can become degenerative. And as those outer annular fibers of the disc become weak, the inner portion of the disc, called the nucleus, can herniate or rupture out through that outer annulus. And that can pinch on the nerves and cause pain, typically causing pain going down the leg, because the nerve gets compressed and that nerve makes up the sciatic nerve, and then the patient can have pain going down their leg. In addition to the discs, these little joints that we talked about, the facet joints, they can become arthritic and worn down through time, bending, twisting. Those joints can become arthritic just like any other joint, including your knee or your wrist or your hip. Those joints can cause pain. They typically will only cause pain in the lower back. They typically will not cause pain radiating down the leg, but they can cause some radiation kind of over into the buttock and upper portion of the thigh. The nerves, of course, can cause pain. If that nerve gets compressed in the lower back, they're going to have pain going down their leg. And that's an important thing to look for when you have an episode of back pain, as to whether or not the patient also has leg pain. The sacroiliac joint, which is this is the sacrum again, and the joint where the sacrum connects to the pelvis is that sacroiliac joint. Those are joints that also can cause a lot of pain. The sacroiliac joint is probably more, or sacroiliac pain is typically more common in women. Women tend to have a little more of a lax or a movable sacroiliac joint, whereas in men it's more of a fixed joint. But certainly any kind of trauma can irritate that joint and cause it to have some micro movement. If there's micro movement there, the joint can become inflamed. Regardless of which structure that we talked about is injured in a course of lower back pain, typically it gets better. Probably the most common cause of lower back pain is actually a muscle strain or a ligament strain. That entire spine that I showed you before, it is wrapped in a series of ligaments, and then around those ligaments is a series of muscles that support the spine. With a lumbar strain type injury that we will often refer to as a muscle type injury, those muscles become aggravated. They tend to spasm when they're trying to protect the area, and those ligaments can get torn as well with any type of trauma or bending or twisting, and the muscle also tends to contract around that. That's probably the most common reason for someone to develop back pain. Again, as I started to say before, most back pain is going to get better on its own no matter what you do. Typically it gets better within a few days. The only true emergency for someone who has some lower back pain is if you develop a condition called Cauda equina syndrome. This is extremely rare, but it occurs when there is compression of the spinal nerves as they come through the spinal canal. If those nerves get compressed, a patient can begin to lose control of their bowel or their bladder. So that is a true emergency. It's really the only true emergency for someone with lower back pain. If you do have those type of symptoms, that needs to be taken care of immediately, and a surgeon needs to be seen to correct that impingement, whatever may be the cause of it. The other thing to be on alert for with lower back pain is any leg pain that may be associated with it. If you're having purely lower back pain without significant radiation down your legs, that again is typically not an urgent situation. It's typically going to get better with some of the remedies that we're going to talk about in a few minutes. But if you do have pain going down the leg, any numbness, tingling, any weakness in the leg, that should probably be seen a little bit quicker than if you just wanted to watch that over the course of a week or 10 days. So here's the treatment typically for patients with isolated lower back pain that is an acute episode. And again, we didn't talk about that earlier, but acute back pain, meaning an episode that just happened, you strained your back, you bent over, you lifted something. That's different than a patient with chronic back pain that's been going on for years, and maybe they've had 2 or 3 different surgeries on their lower back. We're going to focus on that a little bit differently. Today we're talking about acute lower back pain, something that occurred within the past few days. For treatment of that, we're going to want to rest the area, and what I mean by rest is relative rest. Doesn't mean you can't get up and walk around, but you should not be doing any heavy lifting. You should not be doing any repetitive twisting or bending with the spine, but you certainly don't need to have bed rest. A long time ago, bed rest would be prescribed for patients with lower back pain. So again, walking is fine. Gentle weightlifting is fine as long as you're not straining the spine. Ice is extremely important. Ice is much better than heat for an acute injury. So icing that lower back area where it's hurting is going to calm down inflammation. It's going to calm down swelling. You don't want to use heat. Heat tends to bring in more inflammation, brings in more swelling. So we want to ice the area. We want to rest the area. And anti-inflammatories are often very helpful as well. Typically, ibuprofen or Aleve, whatever you may have around the house. Aleve is also referred to as naproxen. Those can be used, taken as directed on the bottle. And those are going to help decrease, again, the inflammation and swelling in the area. If your pain does not get better within 7 to 10 days, that's typically when maybe it's time to go in and seek some evaluation by either a physiatrist such as myself or your family physician or any other physician who may be comfortable with taking care of lower back injuries. At that point in time, once you do need to see a physician, typically there may be some imaging that needs to be done, such as x-rays, typically not an MRI immediately unless there is some concern over a disc herniation or pain going down the leg. Once the imaging studies have been performed, a thorough evaluation to try to find out exactly which structure. We talked about all those different structures that can cause lower back pain, trying to find out exactly which one is causing the pain, because that's going to determine what our treatment plan is. But again, as I stated before, rest, anti-inflammatories, and ice are really the mainstays of treatment, and most back pain is going to get better over the course of a few days. Let's also talk a little bit about prevention of back pain. A lot of back pain can be prevented just through the use of smart lifting, being careful using your legs when you're lifting objects, avoiding a lot of twisting when you're lifting, so getting in front of an object, bending with your knees, keeping it close to your body, lifting it, and then turning your whole body to go set it down rather than this twisting motion back and forth. That's what's very difficult on the spine. Also, what's very important is maintaining a strong core, keeping your core muscles strong around your lower back. That's going to help with keeping your back strong and preventing injuries. Stretching your hamstrings and your hip flexors that can become very tight, especially in those of us who do desk jobs and we're sitting all day long. Your hip flexors can become very tight, as can your hamstrings. And again, as I mentioned earlier, using proper lifting techniques. So I hope that gives everybody a nice kind of overview of the things that can cause lower back pain, ways to prevent it, and simple ways to treat that back pain that typically is going to get better on its own. It's very rare for patients to require surgical intervention, certainly. Typically, it's rare to even require any type of physical therapy or spinal injections or chiropractic treatment. Typically, that pain is going to get better on its own. So we've had some very nice questions submitted by some of you over the last 24, 48 hours. So I'm going to try to answer some of those questions for you, and then we can proceed with any other questions that come in while we're sitting here. So from Brenda. Brenda said, I had IFUSE, that's I-F-U-S-E, in March of this year, and she continues to have pain in her groin and over her hip area. She has been doing some physical therapy. She's tried some dry needling in the thigh and buttock, but has not had much improvement. So IFUSE is a method of fusing that sacroiliac joint that we talked about that can sometimes have that micro movement. So the idea behind it is to fuse that joint together so there's no longer any movement and it won't cause pain. The fact that you're still having pain despite that procedure tells me one of two things. Either the procedure wasn't successful, or number two, maybe your pain wasn't necessarily coming from that sacroiliac joint. As I said before, sometimes the hardest thing is trying to figure out exactly where that pain is coming from. So my suggestion would be to get back in and see the physician that performed the procedure, make sure the physician feels that it was indeed a successful procedure, and let them know that you're still having symptoms, and maybe again it could be coming from a different location. Teresa asks, wondering if you might address hip pain caused by back issues and types of back problems that can cause hip pain. So this is extremely common. My hip surgeon colleagues and I often work very closely together because lower back pain can certainly cause hip pain, and hip pain itself can sometimes refer pain to the lower back. Typically, if you are having a true problem with your hip joint, it's going to present as groin pain, so pain deep in the groin, and it's typically going to be worse with any weight bearing and any type of manipulation of the hip joint, such as crossing your legs or turning the hip joint in and out. Things from the lower back that can cause some hip pain, especially buttock pain, so that part of the hip, the posterior or back part of the hip, that can be caused by a disc herniation in the back, creating some nerve impingement. As I said, those facet joints that we talked about can certainly cause referral of pain over to the hip. So this is where, having a physician or a healthcare professional that is familiar with the structures in the area, do a thorough evaluation, do a good physical examination. Typically, you can determine where that hip pain is coming from, whether it's from the back or the hip itself. Chuck asks, why do I have stiffness in the lower back in the morning before getting out of bed and then get relief with stretching or just going about his normal day until the next morning when the stiffness comes on again? This is a very typical symptom of arthritis. Most patients with arthritic pain become stiff at night because those joints are not moving. As they get up, warm up, maybe take a hot shower, start moving about during the day, that joint starts to loosen up and their pain improves. So this is very typical of those facet joints that we talked about, those little joints in the lower part of the back that can become arthritic over time. Patients with facet pain are going to be very stiff in the morning, and as they get up and move around, that pain is going to improve. Stephanie says, can you talk about steroid injections for sciatica pain? What can you expect from the injection, and what are the pros and cons? So steroid injections are certainly something that I, as a physiatrist, do a great deal of. When they are done for sciatic pain, what's typically happening is that nerve that we talked about that exits the spine that may be getting compressed, either because the disc is pushing on it or because there's just not enough room in that little hole for the nerve to exit. An injection can go in and actually put a steroid on that nerve and quiet down that nerve and help with the inflammation of the nerve and allow that leg pain to improve. Not only am I familiar with doing the injections, but my wife just recently happened to have an injection for this exact type of pain. Within 2 days of having the injection from one of my partners, her pain in her leg was almost gone. So that is an extremely helpful form of treatment for this type of pain that radiates into the leg that is maybe due to a pinched nerve that just isn't getting better with time. Sarah asks, can I lift weights with a bad back? You certainly can lift weights with a bad back. There are certain types of activities such as deadlifts and squats that put a lot of strain on the back. Typically, I tell patients who have a bad back, if you can't do 15 reps, then you have too much weight on with the machine or on the bar, whatever you're doing. You want to always try to have your back flat against the backrest of the machine so that there's not a lot of arching or bending of the back, so your back stays nice and stiff and still when you're doing the activity. You don't want to be straining and arching that back. But yes, you can absolutely do some nice light weightlifting with a bad back. Taylor asks, does a weak core cause back pain? My answer to that would be no, the weak core probably doesn't actually cause the back pain, but having a weak core makes you more susceptible to having a back injury. And especially once you've had a back injury, keeping your core nice and strong is going to help you prevent having more problems down the road. Let's see, the next question. What would it be expected for a person with Ehlers-Danlos Syndrome to experience recurring chronic facet joint pain and muscle spasm as a result of ligamentous laxity in the spine? And what treatment is available if regular exercise and core stabilization has not been helpful? So for those of you who may not be familiar with Ehlers-Danlos Syndrome, this is a syndrome in which a patient has extreme laxity of their ligaments throughout the body. Yes, patients can have more of a propensity for developing some back pain because of this laxity of the ligaments and allowing those joints, especially in the spine, to have more movement. That can lead to some irritation of those facet joints. If strengthening the core doesn't provide much relief and trying to strengthen the entire spine complex around the spine, then sometimes injections can be helpful. But again, you would want to be evaluated by a specialist to really look at that and see if those would be appropriate for you. So I don't see that we have any other questions right now. If you do have any further questions, or if you would like to be referred, there's going to be a link up at the top of the screen here that you can certainly log into and make an appointment with me or one of my colleagues at OrthoIndy. We'd be happy to see you. Again, it's been a pleasure speaking to everybody this evening, and I hope you all have a nice evening. Thanks again.